titled Worst Headache of My Life, Not a Bleed, brought to you from St. Luke's Sacred Heart Family Medicine Residency Program. I am Dr. Irene Atieno Olonde. This poster presentation was also done by Dr. Babatunde Shalanki, Dr. Molly Pneumonitis, and our attending physician, Dr. Manuel Puente. We present the case of a 47-year-old male with 5 days of gradually worsening headache whose chief complaint was worst headache of my life that then prompted workup for an intracranial hemorrhage secondary to a ruptured aneurysm. Turns out that our patient had a dural venous sinus thrombosis, which is less common, however, should be higher on the differential in patients that are younger, have hypercoagulable conditions, and their initial presentation might not necessarily be to that of a neurologist or a neurosurgeon since they usually don't have a lot of comorbidities. The history that prompted his workup is because he had multiple DVTs and pulmonary embolisms that required treatment with rivaroxaban, and this was discontinued 3 months prior to presentation. This diagnosis should be evaluated by complete blood count, metabolic panel, ESR, sedimentation rate, PT/PTT for coagulation, D-dimer level, although if this is negative, it does not rule out a DSVT. And so also a hypercoagulable panel should be done if it has not been done in the past. Our imaging studies were initially a CT head without contrast, as mentioned, that was negative. However, per our stroke protocol, he was admitted for MRI and MRA of the brain and head and neck. Unfortunately, our patient was extremely claustrophobic and did not tolerate this test. Due to worsening of his clinical presentation, a CT vein of the head and neck was ordered that revealed complete occlusion of the left transverse and sigmoid dural venous sinuses. He was immediately started on a heparin drip and transferred to a higher care facility, where this was continued until his follow-up imaging revealed thrombus resolution. Patient was then transitioned to rivaroxaban, which he continues to take up to today. In summary, we present this case to ensure that as family physician, being the primary contact of most of our young patients, that we are hypervigilant to this diagnosis and that we remember worst headache of my life is not always a bleed. Be sure to rule out a dural venous sinus thrombosis. Thank you.